Hi, I'm Joya a family nurse practitioner and founder here at Nourish House Calls. I deal a lot with women in their perimenopause and menopausal years. This is a pretty big transition, kind of like the transition when you got your period. This is another transition that can cause some problems. It can happen as early as those early to mid 30s and as late as early 50s or so for most women. So there's a wide range of when this could start to happen, and care on perimenopause, especially here in the US, but really all over, is really behind the times. And so you really want to find a provider who knows what they're doing, knows what they're talking about, and knows how to treat women through perimenopause. Estrogen and progesterone fluctuations during this perimenopausal time make it super frustrating, and it can almost make it feel like you're chasing symptoms. Testing often shows normal levels of estrogen and progesterone, leading your regular doctor to think that you don't need any help, that your levels are normal, when in reality, we may have just caught you on a high minute or hour when really you have symptoms of and generally lower estrogen or progesterone levels. This is another important reason why it's really important to find somebody who understands what this time looks like and how to treat women during this time. There are a lot of symptoms associated with perimenopause, some that are common knowledge or more common knowledge, and some that are much less. But let's break them down. Physical symptoms are one realm of symptoms that women can experience symptoms during perimenopause. So hot flashes, night sweats, weight gain, poor sleep can be huge, really bothersome issues during perimenopause. Even things like joint pain, frozen shoulder, both of those are really common during perimenopause and often are resolved with proper hormone therapy. One of the symptoms that occurs during this perimenopausal time is irregular cycles. So, for example, you used to be every 28 days and now sometimes you're 23, sometimes it's 32. Maybe you sometimes skip a cycle. Maybe your bleeding has gotten a lot heavier or full of more clots. Those kind of symptoms are quite common during perimenopause. Then there's some emotional symptoms that can happen: depression, anxiety, even racing heart rate associated with that anxiety, sometimes big mood swings or irritability when you're not really an irritable person, just uncharacteristic. You don't feel like yourself. And then there's those cognitive symptoms, things like memory problems or word finding difficulty. You can't remember where you left your keys, or you put your keys in the fridge. I hear that a lot as well. Again, those symptoms can really be helped by optimizing a woman's hormones during this time. There are also real long-term health implications of having low hormone levels, as happens during perimenopause and menopause. Bone, brain, and heart are three that I talk about a lot. When we lose our estrogen levels, our risk of dementia goes up, our risk of heart disease goes up, and our risk of osteoporosis goes up. We want to make sure we deal with those things in a preventative manner so that we don't end up with 60, 70, 80-year-olds breaking hips in the nursing home because they have dementia or they've had a stroke. So what do we do about this? Of course, I've mentioned that hormone therapy is hugely beneficial for the majority of perimenopausal and menopausal women. Lifestyle factors and changes can really make a big difference too. Nothing is typically going to be as powerful as hormone replacement therapy, but the reason that I do a lot of testing and treatment around the lifestyle factors is because they really work, and they really work in tandem with the hormones to help you not only feel better now, but also have lower risk for those things like cardiovascular disease, dementia, osteoporosis. I talk all the time with my patients about their nutrition, their protein intake, their hydration status, how they're sleeping, how they're exercising. Are they getting too much high intensity interval training? And is it kind of pooping out their adrenal glands? We want to guide on all this so that not only are they on the hormones, but they're optimizing as many other areas of their life as they can. Functional medicine is a perfect marrying of hormone therapy and kind of longevity medicine, preventative medicine, because what we can do is we can look at nutrient status and risk factors that are very, very early risk factors. We can do something about those. We can look at GI function really comprehensively and see, is there anything going on there that might be causing symptoms now or cause symptoms later? We can look at food sensitivities and allergies. We can look at all kinds of vitamins and nutrients to make sure we know exactly what supplements you should and should not be on. And then, of course, bioidentical hormone replacement therapy. We can replace individually based on what each person needs, based on their symptoms and their test results, even their genetics sometimes. We can replace estrogen, testosterone, progesterone, DHEA in any dose or combination that we want to. It's really important to find a provider who will listen to you, who will comprehensively treat you, not just send you home with an estrogen patch and not ever follow up with levels or how you're doing again. Really, you want to find somebody who listens to you, cares for you, and really wants to help optimize not only your hormones, but as much else as we possibly can as well. If you're curious if Nourish House Calls is the right fit for you, we offer free 15-minute discovery calls. And so you can book that on our website or clicking the link below. Website's nourishhousecalls.com, but again, there should be a link somewhere here that you can click on to book your free discovery call with us.